Pag-usapan natin.
Ang gamot po na Ivermectin ang pag-uusapan natin ngayon dito sa ONB. Mainit pong usapin ito bago matapos yung nakaraang linggo dahil po sa naging mass distribution sa Quezon City kamakailan. Nagbabala po ang Philippine Medical Association laban sa mga doktor na nagre-reseta ng anti-parasitic drug na Ivermectin sa labas ng mga ospital na binigyan ng compassionate use permit. Ayon po sa PMA, una nang ibinabala ng Food and Drug Administration ang pamamahagi ng hindi rehistradong gamot na magiging paglabag sa FDA Act of 2009. Ito po ay matapos ang pahayag na rin ni Health Secretary Francisco Duque III na dapat imbestigahan ng FDA ang mga ulat ng pamamahagi ng reseta para makakuha ng Ivermectin sa Quezon City. Matatandaan po na dalawang mambabatas ang nanguna sa pamamahagi ng Ivermectin kung saan isinulat lamang ang reseta sa isang papel at hindi po dun sa prescription pad. Ilan pong alkalde rin ang nagpahayag sa publiko na mag-ingat sa paggamit ng Ivermectin laban sa COVID-19. Sinabi po ni Pasig City Mayor Vico Soto na hindi pa sapat ang mga patunay para masabing epektibo nga itong gamot na ito sa pagpuksa ng virus. Hindi rin po inendorso ni Taguig Mayor Lino Cayetano at ang kanilang lungsod ang paggamit ng Ivermectin kontra COVID. Anya kung ano lamang ang inirekomenda ng mga eksperto, iyon ang kanilang susundin. May paalala naman po ang Philippine Pharmacists Association Incorporated. Ayon po sa grupo, hindi basta-basta dapat ipinamamahagi ang isang gamot na hindi pine-prescribe ng doktor. Kailangan nila itong reseta sa isang pasyente matapos lamang ang masusing evaluation. Hindi rin nila lahat ng gamot ay para sa pangkalahatan o sa general use ng publiko. Tinukoy rin ng grupo ang nakasaad sa RA 10918 o ang Act Regulating and Modernizing the Practice of Pharmacy in the Philippines, kung saan hindi dapat basta-basta tinitimpla ang gamot o ibinebenta at ipinamamahagi. Kailangan nila ng kompletong impormasyon ang doktor na magbibigay ng gamot, gayon din ang kompleteng bibigyan nito. At suportado din po ng Philippine Pharmacists Association sa healthcare professionals, HPAC, DOH at iba pang medical societies ang rational na paggamit ng gamot para hindi malagay sa peligro ang kalusugan ng publiko. Sa ngayon po, kaagapay 5 ospital pa lang sa bansa ang binigyan ng compassionate use permit ng FDA. Para samahan po tayo sa ating malayang talakayan, nasa Zoom na po natin ngayon ang ating kaagapay na isang pulmonary and medical care specialist mula sa St. Luke's, Quezon City, at meron din po siyang advokasya on medical literacy, walang iba kundi si Dr. Ana York Bondoc. Good morning, Dr. Ana.
Hi, Miss Haydee, and good morning po sa lahat ng nanonood po sa inyo. It's now the month of May. Ano po?
Oo nga, ang bilis-bilis ng araw at ang init dito sa NCR, Dr. Ana.
Yes, totoo yan. Summer na po.
Oo, nako, iwas sa heat stroke, dapat ang mga kababayan natin. Diba?
Definitely, Miss Haydee. Ang ganda ng topic mo today, ang pinag-uusapan niyo po is Ivermectin.
Correct, oo. Doktora, ano bang masasabi niyo? Sabi ng FDA, 5 pa lang yung ospital na may compassionate use permit. Pero kamakailan po dito sa may Quezon City, meron pong 2 kongresista na namigay po, ng gamot na ito sa may 200 na mga taga Quezon City.
Miss Haydee, balikan po natin what is Ivermectin. Ano po? People just use the name and name dropping or drug dropping para mukhang marunong sila, feeling doctor and feeling pharmacist. But what is really Ivermectin? Ito po, this is a anti-parasitic agent. It was discovered po in Japan. And actually, yung discoverers po nito won the Nobel Prize. Opo. It's a wonderful drug. Okay? It's a really good drug. Ang marketer po nito is Merck. M-E-R-C-K. Ano po? And it is widely used in Africa po for what we call river blindness or onchocerciasis. I cannot even pronounce it. It's very difficult. Basically, it's a parasitic infection po that causes blindness po sa Africa. Malaking problema po ito. Sa Pilipinas, it's also used for filaria. Kasi po, there is filaria po, which is also a parasitic infection in summer. So, widely used po ito sa Africa, okay, for parasites. Ngayon po, it's also widely used for dogs. Kaya may kwento ko, Miss Haydee, mga 2 months ago, nagkaroon po ng yung nasira po yung balat ng mga dogs namin dito. Dinala ko po sa vet. And then the vet gave me po isang bote po na Ivermectin. And said, Doktora, since doktor ka naman, huwag ka nang pabalik-balik. Kasi nga ho namin sa bukid, malayo yung vets, like about 45 minutes. So sabi niya, ikaw na lang inject ng Ivermectin sa dogs mo. So what our dogs ho had, Miss Haydee, is demodectic mange, M-A-N-G-E, which is a parasitic infection para sa balat ng mga dogs. So binigay po, hindi ko man alam that Ivermectin was gonna become famous 2 months ago. So nung binabakunahan ko yung mga dogs ko, sabi ng nurse ko, di ba doktora pang COVID yan? Doon ho nag-umpisa yan. So number 1, it's a parasitic drug used in persons. And number 2 po yung veterinary use nito. This is a veterinary wonder drug. It's also used po sa heart guard. I don't know if you have dogs, Miss Haydee, but there is heart guard tablets po na once a month po iniinom po ng mga aso. So there are 2 uses po for this, for parasitic infections sa humans and for other infections, heartworm po sa dogs. But again, I would like to stress iba po yung formulation for humans, iba po yung formulation for dogs. Okay?
So, paano pong nakatawid, Doktora Ana, na pwede siya sa COVID?
Ito po yun. There have been studies po in the lab. Hindi pa po in person, in the lab. Okay? This is not with a person, in the lab. Na may nakikita po sila na action po ng Ivermectin versus the SARS-CoV. Kasi po, because of the lack of medicines, yung mga scientists po sa world, they tried also medicines para in the lab, titingnan po kung merong, sabi po nila in vivo, that is with live persons. In vitro, yun po yung sa test tube. Right now po, sa test tube, meron pong some action po of Ivermectin versus the SARS-CoV virus. Right now, ang dami pong mga trials ongoing in the world regarding Ivermectin. Pero it has not yet been shown or to be accepted po that it is useful po para sa mga tao pong may COVID. Right now, it's only in the lab. So we know, mga doktor po, whatever happens in the lab, start pa lang, that's only phase 1. Opo. Dun sa mga formulations of vaccines and any drugs, the first starting talaga is phase 1 in the lab. After that po, yung iba lab animals. Okay? After that po, pupunta po sa mga tao. And then, palaki ho ng palaki yung trials. This is for safety.
Kumbaga yun ang SOP. Pero Doc, ang sinasabi ng mga nag-a-advocate nito, ginagamit na daw po ito sa ibang bansa laban sa COVID at marami na daw pong napagaling at wala naman daw pong namatay. Bakit hindi pa daw po kasi i-go signal ito dito sa Pilipinas?
Well, one of the countries po that used Ivermectin heavily was Brazil, and a country po in South America. Where is Brazil now? Di ba naglilibing sila? Nang marami. So, wala pa ho talagang there's really no proven benefit as of today. And the danger po dito is, bakit ang dami namang ginagamit? Pwede tayong magbudbud ng kape. Pwede tayong magbudbud ng kung ano-ano. And we can tell you that's being used in different countries. But unless there is, there is evidence, it is very dangerous po to be advocating things na narinig lang po natin. And sa ibang countries po, there is no successful country. Meron ba, Ms. Haydee? May binabanggit ba? Brazil is famous for having used Ivermectin and they are not in a good situation. Naglalaban too. So, I don't think it has been successful. So, madali lang hong magsalita I'm advocating for Ivermectin. Hindi niya sinabi sa'yo, I am also the importer of Ivermectin. Sinabi ba niya? Tinanong ba natin? So there's always a financial angle po talaga to everything. And people who make pronouncements po in the medical field, they are required po to tell you whether A, they are the importers, B, bayad po sila ba ng drug company, and C, this is what we call po a conflict of interest. It is so easy to say, maganda po ito, and then later on, lumalabas po pala yung importer noon. So paano yun, Miss Haydee? Sana sinabi po nila, they printed, we are not importers and we are not selling. By the way, I am not paid by any drug company. I'm also not the importer of Ivermectin. But ganun po yun eh. We have to look at the financial angle of things. Are you importers? Are you sellers? And again, lumalabag po sa batas yung mga tao po. Because right now, the FDA has not agreed to sell Ivermectin po except outside of these 5 hospitals. And actually, maganda nga ho yung 5 hospitals. You know why? Kasi po, they are required to keep data. Kasi po, madali lang hong magbigay right and left. What is important is pag-aralan po natin yung nangyari po with yung binigyan natin. Did they get better? Did they get worse? Ano po? And then after 3 months, may datos na po tayo. Ang problema, people don't want to gather data kasi alam po nila that the data will not support them. So pag may data na ho at hindi po suportado yun, di magko-collapse yung kanilang business. So buti na lang kung wala na lang data para go na lang ng go, go. But that science works. And tayo po bilang mga doktor and as government officials po, we have to protect the general public. Ang dali lang ho magtinda ng kahit ano eh. But kawawa naman ho those persons who will spend, imbes na pumunta sa ospital, bumili po ng maling gamot, and then later on, paggastusan na ho ng kailangan, wala na silang pera. So, labag po yan sa batas. And I would advise everyone to please think carefully. Kasi po, okay lang kung marami kayong pera, no? But first of all, you know, people are unscrupulous. Ano bang meaning na unscrupulous? Gusto pong kumita, lalo na po sa hirap na panahon ngayon. Pag may nangyari po sa inyo, sinong hahabulin natin? What drug company? And then, Ms. Haydee, people are also being asked to sign papers na kung may po sila from the Ivermectin, wala pong sagutin yung nagbigay. Paano yun? You are supposed to be responsible for what you prescribed. And kung ano man yung consequences po ng prescribe nyo, you have to answer for that.
Pag ganun ba, kasi, doktora, may pananagutan yung doktor? Kasi sabi nga sa mga balita, wala yung license number nila doon. Tapos parang kalahati ng bond paper lang sila nagreseta, hindi talaga sa prescription pad. Yun ba parang mga red flags na yon na something is not right talaga?
Yes, Ms. Haydee. Number 1, ano po, when you take something, you ask mo na sino pong, what company? Nakalagay ho ba yung address? Meron ho ba tayong sagutin dyan? And there are many elements to a proper prescription that includes the doctor's name, the doctor's PRC number, and then the doctor's address para mahabol po natin yung doktor na yon in case anything happens sa inyo. So, hindi po pwede na somebody will just write on a bond paper po without their name, address, and license number. Kaya nga ho nagkakaroon ng PRC licensing. So, pag may problema po, mairereklamo po natin sa PRC. So, yun po yun. And of course, during this time po of panic and pandemic, this is the time po na maraming gustong kumita. And unfortunately po, they are not doing this, Ms. Haydee, para makatulong sa madlang tao. They are doing this to help themselves. Ngayon po, ako, I'm okay. I'm not against Ivermectin as long as it is properly licensed. Pinag-aralan din po ng mga scientifico dito. There are experts who are working for the FDA, some of the best in the Philippines. And let's give them a chance to look at the data and study it. And later on po, kung okay na lahat, what's the harm po of using a licensed drug properly? Ang mahirap po talaga is rushing to use an unlicensed drug and pushing the FDA to approve things that are not yet proven. And in the end po, baka ako magka-problema. Ayaw nga natin yung mga license, yung mga bakuna, bakit gusto natin yung unlicensed?
Mismo, oo. At ang Pangulong Duterte na nga rin po, mismong nag-utos na mag-clinical trial na tungkol sa
Yes, that's
ivermectin
actually
dito.
correct,
Oo.
Miss Haydee. There are many in the world. Let's wait for them. If we would like to make our own, wala naman pong masama doon. That's also very good. And yung data po ng 5 hospitals, i-compile na po yun. Within a month, we can have some idea po of where we are going. Data. Because we are afraid of what the data is going to tell us. Yun po yung hindi po. So, to the general public, nakakatakot po talaga, no? You keep hearing things and talagang parang kakapit ka ho sa patalim. Ba't hindi kayo kumapit sa mask? Bakit hindi po kayo kumapit sa social distancing? Yun po talaga 98% eh. Okay? That's 98%. And I don't know, ang ganda na nun eh. There is data. The data is very powerful po dito sa mask and social distancing. So yun lang po. Isa pang nakakatakot, Miss Haydee, what I'm afraid of is that I'm starting to hear na I'm taking ivermectin, ayoko na lang pong magpabakuna. Again, that's not a wise decision. Kasi po, ang ivermectin, again, no, it's not yet proven. And number 2, yung bakuna po, meron na po talaga tayong datos. So let's go po dun sa may datos po tayo. And later on, I'm not against any drug. What I'm against po is the use of any drug rushing po to use it without proper data. So people claim that ivermectin is safe because 40 years na nga rin pong ginagamit sa Africa. Pero ang dami na huring gamot na 40 years na rin hong ginagamit. That's aspirin, paracetamol, lahat po yan. We can throw that at persons and see how it goes. But that's not the way that science works. So yun po yun. And of course, during this time po of panic and pandemic, this is the time po na maraming gustong kumita. And unfortunately po, they are not doing this, Miss Haydee, para makatulong sa madlang tao. They are doing this to help themselves. Ngayon po, ako, I'm okay. I'm not against ivermectin as long as it is properly licensed. Pinag-aralan din po ng mga scientifico dito. There are experts who are working for the FDA, some of the best in the Philippines. And let's give them a chance to look at the data and study it. And later on po, kung okay na lahat, what's the harm po of using a licensed drug properly? Ang mahirap po talaga is rushing to use an unlicensed drug and pushing the FDA to approve things that are not yet proven. And in the end po, baka ako magka-problema. Ayaw nga natin yung mga license, yung mga bakuna, bakit gusto natin yung unlicensed?
Mismo, oo. At ang Pangulong Duterte na nga rin po, mismong nag-utos na mag-clinical trial na tungkol sa ivermectin
that's actually
dito.
correct, Miss Haydee. There are many in the world. Let's wait for them. If we would like to make our own, wala naman pong masama doon. That's also very good. And yung data po ng 5 hospitals, i-compile na po yun. Within a month, we can have some idea po of where we are going. But if we refuse to collect data because we are afraid of what the data is going to tell us, yun po yung hindi po. So, to the general public, nakakatakot po talaga, no? You keep hearing things and talagang parang kakapit ka ho sa patalim. Ba't hindi kayo kumapit sa mask? Bakit hindi po kayo kumapit sa social distancing? Yun po talaga 98% eh. Okay? That's 98%. And I don't know, ang ganda na nun eh. There is data. The data is very powerful po dito sa mask and social distancing. So yun lang po. Isa pang nakakatakot, Miss Haydee, what I'm afraid of is that I'm starting to hear na I'm taking ivermectin, ayoko na lang pong magpabakuna. Again, that's not a wise decision. Kasi po, ang ivermectin, again, no, it's not yet proven. And number 2, yung bakuna po, meron na po talaga tayong datos. So let's go po dun sa may datos po tayo. And later on, I'm not against any drug. What I'm against po is the use of any drug rushing po to use it without proper data. So people claim that ivermectin is safe because 40 years na nga rin pong ginagamit sa Africa. Pero ang dami na huring gamot na 40 years na rin hong ginagamit. That's aspirin, paracetamol, lahat po yan. We can throw that at persons and see how it goes. But that's not the way that science works, and hindi po dapat. Kasi kawawa po yung general public, Miss Haydee. Hindi na po, there are confusing proclamations po for science, and that can be very dangerous.
Tama, oo, Doktora. So kung lalawakan po natin yung lente natin, Doktora Ana, ano talaga yung problema natin? Bakit parang may mga ganyang uncontrolled na mga nangyayari sa ating paligid? And honestly, Doktora, ako sa akin may mga nag-PPM. Hindi naman sila doktor. In the event daw na may maghanap ng supply ng Ivermectin, i-text ko lang daw siya or tawagan. So, talagang nasa ground na po yung Ivermectin. So, ano po ang masasabi nating what is happening sa bansa po natin?
Napansin niyo yung nag-PPM sa inyo, Ma'am Haydee, nagtitinda?
Hindi ko na tinanong kung magkano.
Hindi ba ganun yun? Okay, you ask them, magdo-donate ba kayo? Silent. Okay? All of us need to earn money. Okay? All of us need to earn money. But sana, let's not earn money on the backs and the misery of people. Yun lang po talaga. Kasi may karma yan, Ma'am Haydee. You know, if you're selling things that you know are not gonna work, don't do it. Masama po yun. And why are we doing this? Miss Haydee, this is not a new phenomena in the medical history. Noon-noon pa, when there is confusion, when things are magulo, which is happening now po, when things are new, this leaves a space for people who are promising differently. Actually, magandang pag-usapan yan, Miss Haydee. It can be very difficult po for regular people to hear na the doctor is not 100% sure that we are still studying things. As a lay persons po, parang people have told me, Doktora, I could never believe that this kind of thing will happen in the year of 2021. Di ba? Parang, what? Hindi pa ba alam ng mundo to? My God, ano ba? So, as a regular person po, if your doctor tells you we are not 100% sure, parang ang hirap tanggapin, di ba? We want doctors to be sure, we want things to be sure, but that is not the way science works. And dun po sa puwang na we are not sure, dun po pumapasok lahat po na nagtitinda ng kung ano-ano. And mapapansin mo, ma-sure pa sila sa doktor, Miss Haydee. Yeah, because they need to sell and they need to step po into that gap. I am a cancer specialist, lung cancer. Ito po yung napapansin ko po. Pagdating po talaga ng stage 4 or things that are really scary, pag sinabi na po ng doktor na we don't know, wala na pong that's the time po that people start to reach out for all sorts of things. Whether they be religious, whether they be
alternative.
Yes. And I often tell my patients, dumating na po tayo sa huli. And I just warn them po na talaga kung marami po talagang papasok dito into desperation, into panic. And then these people are trying to make money po of a bad situation. Sana hindi po. We have vaccines that are available. We have we have also social distancing, masks po. Kaya lang we are here po, Miss Haydee, in the time of instant. Ano po? Gusto mo ng pagkain, tumawag ka ng Grab. Gusto mo ng news, manood ka ng internet, ganun. Gusto po natin ng instant cure. Ang hirap po talagang sabihin that science, it's not instant It takes time, it takes knowledge, it takes effort. And there will be times po na things will not work out and then we start again from. So yun po talaga yung problem. We are facing a pandemic. We want something cheap, fast, and effective. Unfortunately po, we do not want to exert effort. Nakakapagod mag-mask. Gusto ko nang mag-party. Merong Ivermectin po. Actually, meron yung choking ko, ma'am, and I'm trying to stop him. But talagang as the government and as science, kailangan po tayong manalig sa what we know. Kasi
so dapat i-discern natin, ano ba to? Nananamantala lang ba? Gusto ba niyang tumulong? Ayun, dapat maging mapanuri po tayo. Hindi lang natin
Hindi.
basta tatanggapin kung ano yung ibinibigay. Kahit libre pa yon, doktora.
Ay, naku, Miss Haydee, yes, we should not. And that
Oo.
includes all medicines po, no?
Correct.
We have to rely on the government. Meron po silang mga eksperto. We have to rely po. Nagkakaroon po ng data, you know, we are getting data on every person that we vaccinate. Di po tayo nagbabakuna kanan at kaliwa, no? May pangalan po yan, may side effects. Meron pong ways to report problems. Ganun po dapat talaga. And if we
Siguro,
would like to have a trial, we should. In fact, we should.
Siguro, doktora, dapat bigyang diin natin yung FDA as our main regulator. Diba? Kasi ang sabi po ng mga nag-advocate ng Ivermectin, iniipit daw po ng FDA.
Really, one of the things, you know, I galit naman tayo pag nag-aano, you know, it's very difficult to be in the FDA right now. We are angry pag hindi ho inaalaw. We are angry naman po pag inaalaw. So, ang hirap po talaga to stay with the data and to bank on science. Pero during confusing times, that's really the best way. Kung hindi po, we will be pushed po by politics, by financial interests po, and kawawa po ang madlang tao dyan.
Okay.
And then again, one thing that we can find out, Ms. Haydee, also is to follow the international experience.
Okay.
Meron na po bang bansa that has approved this? Ganun po. Why should we be, alam mo, galit tayo kasi walang bakuna. So I said it's good na we can wait and see what the others are doing. So bakit tayo gustong mauna tayo sa Ivermectin ngayon?
Kahit nga yung Merck, diba, sinabi nila, hindi ito gamot sa COVID.
Yes, actually, the first
lang.
company po that produced Ivermectin for 40 years is Merck. And sila ho mismo, do you think kung may blockbuster drug sila, number 1 na po silang magtitinda po nito? But unfortunately, hindi po. No, they are also studying po Ivermectin. So, I'm not against Ivermectin. What I'm against po is the process of rushing kasi marami pong getting the wrong information, thinking that Ivermectin is better than vaccines. Wag na lang mag-mask kasi may Ivermectin, and all of these attitudes po are dangerous, Ms. Haydee.
Iniinom daw po kasi ni Senator Juan Ponce Enrile na ang haba ng buhay.
There are many reasons kung bakit mahaba buhay this summer. That's a good point. Well, I don't know, you know, I can only tell you po the best advice. Ngayon po, again, there is personal choice po in everything that we do, Miss Haydee. Pero sana po, let's think twice and let's follow po talaga yung tamang proseso. Kasi po pag may nangyari, saan po tayo, where will we run? Opo. At anong pong gagawin natin? At sa internet, merong positive about Ivermectin, but there's also a lot of, if you read about it, I gave my dad Ivermectin and namatay po siya. So, you know, it's hard. Opo. And it's very difficult. This is a dangerous time po talaga because of mabilis po yung pangyayari. Of course, we are panicked. And of course, I hate to say this, but we are looking for an easy way out, Miss Haydee. And, you know, wala po talaga eh. It includes vaccination. I think we have seen that po talaga na sa UK, Miss Haydee, 4 na lang ang namamatay sa bawat araw. And they are preparing na po to remove their mask mandates and to allow po social gatherings. So again, makikita po natin what will be the outcome po nito. So sa Pilipinas po, I would advise everyone to follow the government, wear a mask and social distancing, magpabakuna po pag kayo po ay tinatawag. And there's nothing wrong po with following closely the clinical trials po of Ivermectin and seeing po what happens.
So, Doktora, since parang ang dami nang parang underground na Ivermectin na available sa public, ano po ang masasabi nyo kung ang paniniwala ng isang tao, katawan ko to, so choice ko kung ano yung iinumin ko, kung ano yung ipapasok ko sa katawan ko?
Well, that is the person's choice, ano po. But it is also the government's mandate na hulihin po yung mga gumagawa po ng mali. And those doing wrong are those selling unlicensed drugs. So, may kaso po yan. And for doctors who are compounding their own medications, nabanggit nyo na rin po, there is also a law, yung the one that set up the modern FDA. There's also an anti-dispensing law. Yung pupukpok ka doon sa likod ng bahay mo, then lalagay mo sa kapsula, then ititindam nyo po sa kapitbahay nyo. May batas po doon. The only persons who are allowed to do that are pharmacists. And again, they have to be guided po by the FDA. So if you want to buy that, wala po kaming magagawa. Sana you be aware po of the consequences. Pero the government po is mandated to run after po yung mga nagtitinda kasi po may kaso po yan, Ms. Haydee.
So talagang siguro doktora no, isa sa to combat itong talagang desperation ng tao sa cure, sa solution laban sa COVID ay yung pagdating talaga ng mga vaccines. At saka doon tayo magbugbog talaga ng mga proper mga information tungkol sa bakuna. Kasi yun nga mas takot yung tao sa bakuna kaysa po sa Ivermectin.
Well, yun nga, yun Ms. Haydee. Matindi po talaga yung we are facing a wave of anti-vaccine information, which could actually be deadlier po than COVID. Kasi po, ang misinformation, napakahirap pong i-correct, lalo na po pag naitanim na po sa ulo po ng mga tao. So, sometimes, and I would say the government is also guilty of this. Sometimes we think na this is the truth, it's gonna happen. Unfortunately, that's not the way modern nangyayari po ngayon, just because it's true doesn't mean people are going to accept it. Kasi, so kailangan po talaga, kung we have to market, saklap sabihin, but we have to market the truth. And we have to, we have to market the truth, Ms. Haydee, ano ba yan? But we need to do it kasi po nauna na po sa atin yung mga anti-vaxxers at yung mga tao, unfortunately po, na kumikita from whatever po that they are promoting. And that is sad.
Siguro, doktora, kung ngayon nagdo-double, triple time ang ating pamahalaan to disseminate mga information about the vaccine, mas quadruple pa na talagang effort para paniwalaan, maging confident ang tao sa vaccine.
Ito yung problema we are trying to fight emotions. Kasi these kinds of these kinds of attitudes are two things They are beliefs, and number two po, they are emotions driven by fear or driven by the current environment that is around us po. No? At saka may yung kultura and history. So as scientists and a lot of doctors po, we are trying to fight emotions and beliefs with facts. Parang laban po yan na mali. If the fight is emotions, we have to fight again with proper emotions. Kumbaga, just saying the facts, Ms. Haydee, tayo pong dalawa, baka maubusan po tayo ng laway saying the facts. But there will be people who will never believe this.
Yes.
So, po talaga, we have to look at what touches the heart of the Filipino at dun po tayo umatake. Kasi, Filipinos, of course, they are very, very intelligent. Ako po, I believe that we are a strong and mighty nation. Unfortunately, maramdamin din ho tayo, Ms. Haydee. So, we are also driven po by our emotions. And sana po, we use this. Like, for example, sabihin natin, do you love your parents? Diba, Ms. Haydee, lahat tayo may parents. Lahat po tayo may grandparents. So, we have to find a way to give the message po na hindi po siya dictatorial, like gawin nyo to. Kasi ayaw po niya ng mga tao. They have to be able to reach it, understand why they need it, and then they will value it. Hindi po pwede yung magdidikta lang tayo na do this, do that. Hindi po ganun. And it's a hard lesson for doctors po. I think marketers might know this better. But it's really so sad that we need to market the truth and the proper public health information, but we need to do it. And the sooner that we realize it, Ms. Haydee, the better po for our country.
Ang atin lang naman din, doktora, since may mga studies na, hintayin na natin yung resulta.
Yes, Ms. Haydee, I agree. There are studies coming out and let's wait for it. Please don't let your panic maunahan. Let's follow the government, let's get vaccinated, and let's use po yung proven, which is mask and social distancing, kahit po mahirap.
Okay.
And Miss Haydee, congratulations po sa inyo that your program is always trying po to promote science. Kailangan po talaga ngayon. And very logical ang mga pronouncements niyo. Congratulations, Miss Haydee and the DZAS team.
Thank you, Dr. Ana, dahil lagi namin kayong kapartner para po magpalaganap ng mga eksplanasyon na talaga pong sabi ng mga kaagapay namin, nakakatulong daw po para maintindihan daw po nila yung mga balita sa paligid natin ngayon. Stay safe, Dr. Ana.
Kayo rin po, ma'am. Stay safe and good morning po sa lahat.
God bless you. Nakausap po natin ang ating kaagapay, suki dito sa Oras na Pilipinas, si Dr. Ana York Bondoc, isang pulmonologist at isa rin pong kaagapay natin sa pagpapalagana po ng mga impormasyon patungkol po sa COVID.